bring you stories of ordinary people affected by TB and the difficult situation they find themselves in. Their poverty, their malnutrition, their living conditions, and their social and cultural barriers.
दुनिया की तुलना में टीबी के मरीजों की संख्या हमारे यहाँ बहुत है। टीबी से अगर मुक्ति पानी है तो एक तो करेक्ट ट्रीटमेंट चाहिए और कंप्लीट ट्रीटमेंट चाहिए। बीच में से छोड़ दिया तो वो मुसीबत नई पैदा कर देता है।
Near Delhi's Tughlakabad fort is Asia's largest unauthorized colony, Sangam Vihar. Nearly 12 lakh people live here, fighting for survival. The colony lacks water supply, proper roads, sewerage system and garbage collection. 45-year-old Radha lives in a house in one of the 50 square yard plots with her 7 children.
At different stages in the last 3 years, 3 members of this family were affected by TB. Each case was different and each member responded differently. Surprisingly, only one of them was able to benefit from the government's treatment program.
Radha Devi tells us her husband, an out-of-work tailor, had become an alcoholic. 3 years ago, he was diagnosed with TB. He was a difficult patient and refused to be guided by rational decisions. For a patient like him, fixed OPD hours at government hospitals was a problem. A private practitioner was available through the day. Though they could not afford it, they went to the private practitioner.
अब सरकारी में ऐसे तो कि मैं लेके गई और चेकअप को उन्होंने लिख दिया इस दिन आना, तो जाते नहीं थे। प्राइवेट में तो जबरदस्ती पकड़ के ले जाओ। अब वहाँ तो डेट देते हैं, अगर उस डेट पे पहुँचो ना तो काम नहीं होता, फिर आगे और बढ़ जाती। फिर डॉक्टर डांटते थे हमें कि क्यों नहीं आई इस दिन। फिर ठीक हो गए। फिर ठीक होने के बाद 2 महीना के बाद में मतलब उन्होंने फिर दारू पीनी शुरू कर दी थी। और दारू पी में फिर बुखार आया। बुखार आके फिर उनका टीबी बिगड़ गया। फिर उन्होंने दवाई कम खाई, हॉस्पिटल में भर्ती रहे 11 दिन वहाँ मेहरौली में।
The Lala Ram Swarup Institute of Tuberculosis and Respiratory Diseases, a premier institute for promoting the government's national TB control program, is at Mehroli.
वहाँ से छुट्टी कर दी थी डॉक्टर ने कि मतलब अब ठीक है, इन्हें दवाई इनकी चलाएंगी साल भर। तो नहीं ठीक है, तो यहाँ कहीं पर बताओ तो क्लिनिक है, कहीं वहाँ से खवाई ला करना। तो मैं वहाँ ले जाती थी खवाने के लिए। तो 2-3 बार गए, फिर चल नहीं पाए तो मैं घर पे ले आई खवाने के लिए। तो कभी खा लेते थे, कभी गुस्सा में खाते ही नहीं थे कि मैं खाऊंगा ही नहीं। फिर उनकी 70वें दिन हॉस्पिटल थे, छुट्टी करा के लाए थे तो फिर खत्म हो गए थे। हाँ, उन्होंने गलतियाँ बहुत ज़्यादा की।
The 9-member family live in a 2-roomed tenement, and a little before his death, his 23-year-old daughter Sonia found she had TB. While the father's case had been poorly managed, Sonia's was different. The fact that she had received a school education made her both aware and motivated to fight against TB. She sought and completed treatment from the government's DOT Center. DOT stands for Directly Observed Treatment Short Course.
पहले तो मुझे डॉट्स का मतलब ही नहीं मालूम था। जब मेरे घर में फादर को हुआ तो फिर इसके बारे में पहले तो हॉस्पिटल में गई, थोड़ा बहुत वहाँ से नॉलेज ली, फिर बाहर से पूछताछ करना शुरू कर दिया। जब उनका ट्रीटमेंट चल रहा था ना, तो उसी के साथ साथ ना धीरे धीरे मैंने भी अपनी क्वेरी करना शुरू कर दी कि क्या है, कैसे होता है।
A year later, her 17-year-old brother Sumit also got TB. Sumit, who was frail after an earlier gastrointestinal surgery, developed jaundice. His treatment was started at the government hospital in Mehrauli.
दवाई जो मेहरौली वाली खवा रहे थे तो इसका उलझन बढ़ रही थी और घबराहट हो रही थी, बहुत परेशान करता था, दवाई दे देते थे। तो मैंने चलो कोई बात नहीं, फिर जो खूब रोया एक दिन बैठ के।
Sumit was unable to deal with the toxicity of the drugs, and the government's treatment program was unresponsive to his difficulties. He was taken to a private hospital where the dose was adjusted to suit him.
अब फ्री वाली इसे सूट नहीं कर रही दवाई, ज़्यादा हार्ड है। अब यहाँ पे मतलब हर चौथे दिन चेकअप करके दे रही है अपने आप, मतलब खून टेस्ट करके फिर इसकी दवाई चला रही है।
Skilled counselling under the government's program could have helped families like theirs meet the treatment challenges and break the chain of transmission. But no health worker or counsellor visited them. 3 people with TB in a family had not set off alarm bells in the health system.
नहीं, कुछ नहीं बताया, किसी कोई आया ही नहीं है।
In Indirapuram near the Delhi UP border, Jalisa works as a housemaid. Her husband is a rickshaw puller. The couple live with their 5 children in a windowless room. They pay 2,250 rupees a month as rent for the room. 3 years ago, their daughter Sakina developed some lumps on her neck. It remained undiagnosed for a year as the parents went to different quacks for treatment.
1 साल तक दवाई दिया, फिर मैं गांव गई, गांव से भी दवाई खिलाया, फिर वहां से यहाँ आई, फिर यहाँ दवाई खिलाया। जब ज़्यादा होने लग गई ना, जब दीदी को बताया, जब दीदी लेके वहाँ गई।
At this private hospital, it was diagnosed as extrapulmonary TB.
बुखार वगैरह तो नहीं है।
Some of the symptoms are loss of appetite, loss of weight, night sweat, low-grade fever, swollen lymph nodes.
और वजन भी कम हुआ।
Childhood TB is difficult to diagnose, and she had not been tested so far.
Tuberculosis can occur in the body right from head to toe, anywhere. On skin, on abdomen, chest, lungs, brain, eyes, everywhere it can occur.
Sakina, who's 5 now, has fully recovered. Her treatment was subsidized by her employer and the hospital. We asked Jalisa why she had not considered going to a government hospital despite diagnosis and treatment being available free of cost.
दूर पड़ता है ना सरकारी हॉस्पिटल। यहाँ जो होता है ना तो दिन भर काम करके भी 7-8 बजे भी चली जाती, कभी छुट्टी में है तो 11 बजे भी चली जाती।
The loss of a day's wages is considerable for Jalisa and her husband, who together earn 11,000 rupees a month. The irony is that though there is a DOT center near their house, the couple is totally unaware of it. There is low awareness of TB and its treatment in the absence of effective mass media campaigns. These ground realities have to be taken into account to ensure all people affected with TB get correct and complete treatment.
People gain up to 10, 12.
A major challenge to the National TB Control Program is posed by migration.
A lot of migration takes place. Once they start getting better, they like to go back to their state, and that can be a very early part of therapy only. So they default at times. Even we try to make sure that they get that treatment where they're referred out. We have a referral system in place also. But then very often they go without even getting the referral papers made. They just default.
Another challenge is co-infections. Activist Mona Balani has been living with HIV for 17 years. The risk of developing TB is 8 times higher among those living with HIV as compared to those who do not have HIV. In 2002, she was affected by pulmonary TB and her treatment was completed. Then 3 years later, she got TB again. This time it was extrapulmonary TB.
15 to 20 pills I have to take in a day. And it was so difficult for me. Even when I swallow that pills, so the pain is here. And then I feel something is like very heavy thing is going inside my stomach.
Problems of drug toxicity among people with co-infection lead to poor adherence and loss to follow-up, increasing the chances of treatment failure. TB accounts for an estimated 25% of deaths among people living with HIV in the country.
जो हमारे ड्रॉप आउट केसेस होते हैं ट्रीटमेंट में, हम उनको क्लोजली मॉनिटर करें और काउंसलिंग पार्ट इज़ मस्ट इन दैट कि जो ट्रीटमेंट अडेरेंस है. एंड द सेकेंड थिंग कि जो ट्रीटमेंट लिटरेसी और एजुकेशन है. अगर आप देखेंगे कि आज PLHIV मूवमेंट इतना स्ट्रॉन्ग क्यों है, इसीलिए है क्योंकि खुद लोग जानते हैं, HIV के साथ जो लोग जी रहे हैं वो जानते हैं कि मुझे ART लेना कितना महत्वपूर्ण है। अगर ऐसे ही TB के बारे में, ट्रीटमेंट के बारे में लोगों को एजुकेट किया जाए, देन इट रिड्यूस द ड्रॉप आउट केसेस।
The government's program has not been designed to address people who face a difficult situation. For instance, those who migrate out of extreme poverty, those who are drug dependent, and those who have a co-infection.
However, a few of these challenges have been identified. Take, for instance, childhood TB, which has been neglected, even though it leads to a lot of deaths and morbidity.
Childhood TB most of the time comes from infection that the child gets from adults, either in the household or other adults they're exposed to. So it's very much preventable and as well as treatable in the early stages when detected. Less than 20-25% of children in households of TB patients were actually being screened. And now with some interventions, that number is increased.
The government has now put in more advanced molecular diagnostics in place. Nearly 600 gene expert machines have been installed that tell you about drug resistance and give you a rapid diagnosis, much better than microscopy being used all these years. However, to ensure early detection of cases, the priority is to go into the community instead of waiting for people with symptoms to walk in through the door.
In congested localities like this one in Delhi's Turkman Gate, the possibility of finding people with symptoms of tuberculosis is very high. Active case finding means door-to-door surveys, screening for symptoms and referrals.
Tuba Khan is a community volunteer under Project Akshaya. Akshaya means TB free. The challenge is that TB is still a hidden disease. Tuba goes door to door inquiring whether a family member has symptoms like cough, fever, fatigue and loss of appetite. She is often treated with suspicion, but she persists.
मुझे कहते हैं किस काम से आया आप, सरकारी कोई ऑफिसर हैं, बहुत सारी सवाल करते हैं लोग मुझसे। तो जब मैं उसको कहती हूँ नहीं, मैं स्वास्थ्य केंद्र की तरफ से हूँ और टीवी हम जड़ समेत हिंदुस्तान में ख़त्म करना चाह रही हैं, तो टीवी की नाम सुनते ही कहते जाओ तुम, हमें क्यों होता है, अल्लाह ना करे हमें हो, तुम्हें होगी। मैंने कहा नहीं नहीं, प्लीज आप सुनिए तो।
Tuba is creating awareness about the signs and symptoms of TB and referring people for diagnosis and treatment to the nearest public health facility. After the diagnosis, the people are supported for treatment adherence.
तो वो दीदी से मुझे ये मदद मिली, एक तो ये बेचारी आती हैं, मुझे सब चीज़ें बता के जाती हैं, सारी चीज़ें सहायता देती हैं मुझे सबसे ज़्यादा। तो इनकी अभी मेरी दवाई जो थी बीच में रुक गई थी, तो फिर मैं दीदी के पास ही गई थी पूछने के लिए।
The objective is to expand the reach, the visibility and effectiveness of the National TB Control Program.
There are nearly 1 million TB cases that are not yet linked to the government's National TB Control Program. These are the so-called missing cases.
The Akshaya project is being implemented in 374 districts across 23 states by NGOs. In Haryana's Sonipat district, Rohtash works as a carpenter. He says the community worker Ritu helped him to get the medicines.
दवाई तो यही लेते हैं
आपके लिए?
हाँ जी।
और आप दवाई ले रहे हैं या नहीं ले रहे हैं, उसके बाद कभी आपके घर में आए?
दवाई के बारे में चेक करते हैं जी, मेरे को बोलते हैं।
कम्युनिटी मीटिंग में इनको बुला के सब कुछ इनको समझाते रहते हैं। जैसे डॉक्टर साहब बोलते हैं कि प्रोटीन डाइट लो, जैसे जी स्प्राउटेड ये खाओ, दाल वगैरह और हरी सब्जी वगैरह।
Rohtash lives in one room with his wife and 5 children, a room with little air circulation. TB is often called the disease of poverty, as conditions like overcrowded rooms, poor nutrition allow the TB bacillus to spread from one infected person to another. Rohtash's family members, however, had not been screened, tested and properly counselled. His neighbour Sonu's diagnosis was delayed by over a month as he went to 3 private treatment providers, including a faith healer, spending over 11,000 rupees.
टाइफाइड का झाड़ा लगता है कुरुक्षेत्र के पास में, वो झाड़ा लगवा के आ गया उसके बाद भी मेरे को आराम नहीं हुआ तो मैं दूसरे डॉक्टर के पास गया।
The community worker suggested he get tested for TB. The test was positive. Now 5 months later his mother has TB. Her diagnosis too had been delayed.
ये तकरीबन 1 महीने के करीब हो गया था इनको बुखार आते, तो बीच बीच में क्या था, ये दवाई ले लेती प्राइवेट तो ठीक भी हो जाती थी। जैसे अब पीछे 1 हफ्ता बिल्कुल ठीक रही, उसके बाद फिर बीमार हो गई। तो मैंने बोला कि मम्मी ऐसा है, आप भी एक बार टीबी चेक करवा लीजिए।
Ritu collected her samples for testing.
एक्सरे इन्होंने करवाया, सब कुछ टेस्ट वेस्ट वहीं हुए जी मेरे, फिर दवाई भी स्टार्ट वहीं से करवाई इन्होंने।
15 दिनों से ज़्यादा खांसी होगी।
To bridge the large gaps in diagnosis and treatment, the Akshay project has to be strengthened further with more resources. More trained health workers and skilled counsellors are required for a closer engagement with the community. The spectrum of active TB is complex, from pulmonary to extrapulmonary and pediatric TB. The government's national strategic plan shows that despite achievements, undiagnosed and mistreated cases continue to drive the epidemic. TB remains an enormous public health problem. Drug-resistant TB is on the rise, mostly due to earlier inadequate treatment. Nearly 1 lakh cases of serious multi-drug resistant TB are estimated to occur in the country every year. 16-year-old Anu of the Toli village in Sonipat has been diagnosed with multi-drug resistant TB. She needs long and sustained engagement by health workers, as the treatment for drug-resistant TB can go on for over 2 years. Anu was in 10th grade in school but was forced to drop out. Her weight is improving now after the treatment, but it had dropped to 21 kilos.
कहाँ से लगेगी मैम? जब ग्रोथ इसका बढ़ने का उम्र का उस टाइम में इसको मेडिसिन खाना पड़ रहा है तो कैसे होगा?
Making matters worse is the fact that she can't play with her brother.
ये तो भाई के साथ तो मैंने इसका तो खेलने का सब कुछ बैन है।
अच्छा, सब कुछ बैन?
हाँ, मैंने बैन किया हुआ है कि भाई दूर से अपना, बाकी अपना बाहर मैं अपना खुद गाइड कर रहा हूँ इस चीज को।
अभी नहीं खेल सकते तो कुछ दिनों बाद तो खेल सकेंगे।